My name is Robinah Kaitiritimba. I work for Uganda National Health Consumers Organization, and I'm based in Kampala, although we operate in the districts. Uganda National Health Consumers Organization is a health rights advocacy organization. So we do advocacy for the right to health at policy level, looking at policy and trying to work with the government and the Ministry of Health to see that policy reflects the rights-based approach. Then we work at community level to engage with community to build their capacity so that they are able to know what their rights and responsibilities are and be able to follow the system and monitor and ensure that their rights are respected and that they also carry out their responsibilities. There is a number of rights that we work with, and they are derived from the international instruments that guarantee the right to health. And the basic ones, especially in this country, that seem to be a challenge is the right to participate, the right to be heard, what we call voice, the right to information, the right to privacy and confidentiality, the right to minimum care, the right to referral, to be able to refer to another specialist, the right to be in the decision making that concerns your health. The community, mostly we want them to understand policy, basic policy principles. So if you have a health center 1, what kind of services do you expect to receive at that level? Do not come to health center 1 to deliver. Don't come to health center 1 to get an injection. That they need to know that health center 1, according to policy, is the first point of care, and if they need advanced services, they need to go to the next level. We also want them to know that there are structures in the policy that facilitate their voice. So we work with the community to strengthen this structure and to get them to let their voices be heard through this structure or even independently. So we build a platform where the community can engage and ask those questions and make those demands. It may not deliver what exactly they want, but it's important to have a way for them to demand accountability from those whom they have elected, from those they employ, like the hospital, like the district officials. But also, the patient's rights are constantly abused. Attitude of health workers, the health centers close when they should be open, the question box where they are supposed to complain is not functional, the medicines are not available sometimes, they come and wait for a long time, they don't understand what is happening, and we try to get them to own these services and build their capacity to demand and understand and follow. A lot of investment has been put in addressing the current, today's issues. And yet, if we build capacity for prevention, and all of them, HIV, malaria, TB, maternal health, all of this, if we started at the community, I think we would be able to save and we would be able to make a difference in people's lives. We have determined with evidence that over 70% of the disease burden can be prevented. I think the current VHTs lack more training, but they are also not equipped, they are not facilitated. They need to visit homes and spend some time there and understand the problems and be able to work with the community. They have not been given the resources to do that. They do not have the training, are not equipped with skills and competences that will work effectively at community level. I think we think that communities will do what they tell them, but we have seen over time that no, they will not do what you have said. They will do what they believe. what they think works for them. And the village health teams I have seen, I don't think they are community people equipped with skills that engage and convince the community to take one direction or another. But we have also seen health workers who work more like 24 hours. So a health worker like that also can't do much. A woman also called me and said, I'm here, the mother has died, the baby is in the stomach. We cannot even get somebody to cut the stomach and remove the baby, and we cannot bury them together. So they are real desperate stories, and the system and information, if it doesn't work for them at that stage, then what is it for? I'm sure that we don't have the resources that some other countries may have, but I also know that we are not a poor country. We are not a poor country, but I think we need to reorganize health financing. I think there's an urgent need to reorganize health financing. One of the things we've been working on is health insurance. I have seen West African countries where they have started health insurance, including Ghana and Ivory Coast, I think. They are working on health insurance. I think there are lessons we can learn from there. And of course, the other countries also are doing a lot on community mobilization for prevention. Whereas it may be difficult for individuals to believe and do certain things, I think bringing the community together to do an assessment of their problem and looking for a solution together as a unit would be extremely helpful, because you have some convincing others to sleep in a mosquito net, to go for services early, to deliver at the health center. I think building the community capacity would be sustainable and is more helpful. And we have seen it because communities organize around barriers. When a death happens in the community, they have systems that collect money early and everybody comes to the rescue. And they are doing it. We have seen it. They are also now, they have financing circles, women's circles, men's circles, young people's circles. And these circles collect money and put in one bag and help each out. Even in the city, you have people who come together as 10, 5 in an office like this. They collect money this month, they give to one person, another month they give to another person. So we just need to convince the community that this is good for you, but also let them, we can support them to build the ideas and information, but I think it's important to let them do it themselves. I think that's when they own it and they like it and they're enthusiastic and they can run away with it. There is need to build systems as central government. But I think a lot of the work needs to be done. We need to start from the community. I think, in my view, it's a huge investment. Sometimes we talk about it and we think it will happen like this. It's a huge investment. It is also long term. But I think it would be worth it for us to start at the community and put the resources there. We may not be able to do everything at once, but I think it's important to learn and do one item at a go. I think the other thing is for us to translate health into a sort of what are the economic benefits. I think Uganda can take leadership in the region in health and healthcare, but I think we also have a lot of investment in terms of leaders and structures at community level, but they are not focusing on health. I think if they focused on health like they focus on other things and provided the right leadership, we would be able to make progress.